Welcome to the Living Healthy Podcast, where you can improve your quality of life by making solid and informed decisions. I'm your host, Eddie Randall. Thank you for tuning in to episode 15 of season 2 of the Living Healthy Podcast. Please feel free to check out the latest merchandise at the Living Healthy Podcast store. The link is in the description of the podcast. I hope everyone had a very Merry Christmas. This Christmas season, the weather has been very, very cold, and I hope you all are staying warm and safe. Tonight's episode is a little short, but it's packed with value and insight. Tonight's podcast focuses on two facets of healthcare: value-based healthcare and fee-for-service healthcare. All of us at one time or another had to use our health insurance to see our primary care physician or have a surgery performed. We're mostly concerned with getting the best coverage we can to cover our family and ourselves. We don't really look into two of the most influential dynamics in healthcare. They are the value-based and fee-for-service models. Tonight, I will be briefly touching on their differences, pros and cons, as well as what it means for us and our healthcare system. Tonight's podcast is entitled Exploring Value-Based Healthcare versus Fee-for-Service Healthcare. Value-based healthcare is what some would call the ideal healthcare model. This model is based on promoting the best healthcare outcome possible, all while keeping the costs low. In this model, healthcare providers are paid on a successful outcome, not on an individual outcome. The major premise of this model is that it's based on preventative care. An example would be promoting annual visits and staying on top of an individual's health before it has a chance to take a turn for the worse. A further example would be to have your blood drawn every year to check your cholesterol and triglycerides at your annual visit. Doing this can catch unknown detriments such as high blood pressure, and dealing with it before it has a chance to have a significant impact on your health. After all, hypertension is the silent killer. ERs across the United States at any given time have people coming in for angina or those who have suffered heart attacks or strokes. A significant factor is that they may not have been on top of their cholesterol levels. Another premise is the idea of preventing hospital readmission. If you see your doctor once a year and not as needed, you will be able to stay on top of your health, which prompts lower health costs and, most importantly, prolongs your life. The value-based model is patient-centered and rewards or penalizes healthcare providers on the cost and quality of care given. In this model, the provider is paid on successful outcomes. Services are bundled and then paid together and not individually. So the provider is incentivized to focus on quality rather than quantity. How it works is that a provider would be paid a single-time payment upon billing rather than for individual tests ordered or surgeries performed. Some argue that the Affordable Care Act was initiated as a building block for the value-based healthcare model. Some state that its goal was to eliminate current issues in the healthcare system and make healthcare insurance more affordable, expand Medicaid, and lower healthcare costs. Whether it works or not, I am not discussing. I'm only mentioning it because the intent of the Affordable Care Act was to align with the value-based healthcare model. According to the Medical Group Management Association, only 7% of primary care providers in the United States incorporate the value-based model. I will add that every provider, whether they are in primary care, surgery, GI, or neurologists, or any facet of healthcare, they all use the different models interchangeably. They do this to help as many people as possible, and it largely depends on the patient's situation. Healthcare providers have your best interest at heart and will do the absolute best to help you. They have dedicated their lives to helping people to stay healthy. And when you're healthy, you can enjoy your life to the fullest. The pros of this model are that the patients are the focus of healthcare. Chronic illnesses are better managed in order to reduce illness and hospitalization, thereby improving patient health. Providers are paid on the quality of care, and the idea of quality over quantity is of foremost importance. And lastly, decreasing cost makes healthcare more affordable and will allow services to be more available to more people. Cons of this model include patient volume. An increased volume could lead to less availability of the providers needed to initiate care. It could also lead to a shortage in clinicians, as an issue could arise in bringing in new providers. Complicated cases could also prove to be more challenging, as the providers would have to take on issues that they may not specialize in. They would have to find the most cost-effective way instead of focusing on the patient's health and the next step in their care plan. Data sharing can also be a problem. Patients can have lived in other states or other countries and moved to a state or country and at some point would need health care. They may not have their complete records or remember certain important details in their health history. Some facilities do not use the same medical record system and may not have it set up to share information easily. This can cause tests to be duplicated and instead of helping, could actually slow down the progression of delivering the best overall outcome for the patient. The other healthcare model is called fee-for-service. This is the traditional healthcare model and by far is the most popular and the current model that we use. This model involves hospitals, clinics, and providers being paid for each individual service. They are unbundled, so they're paid separately. Providers are rewarded on volume rather than the outcome of services provided. Some argue that this has caused the healthcare industry to encourage billable visits, tests, and procedures to simply increase volume. Others say that the number of visits, tests, and procedures allow providers to stay on top of their patients' care. If you visit your doctor more often and have more avenues of your health examined, you will be able to stay on top of your care and also determine any underlying illness. The pros of this model are, as I just mentioned, it can cause people to see their doctor more often. One of the biggest pitfalls in the health of Americans is that despite having this system, most don't go to the doctor regularly and instead go to the ER, as by that time the preventable or manageable problem has instead turned into something that can be life-changing and detrimental to longevity. With this model, you can also see the most expensive and best qualified providers. The only thing is that your insurance company may only cover so much, depending on your plan and insurance type. You can pick and choose your doctor, as you would be able to get into some specialists easier. Under the former model, some doctors would be responsible for health outcomes that are beyond the scope of their practice. You also have greater flexibility on your health care. As an example, some insurance companies and even Medicare and Medicaid have providers and facilities set up in your billing area for you to see based on what your healthcare needs are. If you have researched a particular doctor on your own and wish to see that one, you can simply go out of your network and pay the difference, once the insurance company, Medicare, and Medicaid have paid their part. Cons for this model are that you can be denied service. That doesn't mean that you're kicked out onto the street to fend for yourself. It simply means if your insurance is not accepted, or if you don't have insurance, don't qualify for Medicare, Medicaid, or county programs, then you're referred to your primary or to your insurance company or a facility that does self-pay. Another drawback for this model is that insurance plans can be expensive. This is in regard to premiums and out-of-pocket costs, as some of these costs must be paid up front, mostly in some healthcare specialties. Uncontrolled expenditure is another drawback, as some state that providers will order services unnecessarily. In addition, your insurance may not cover as much of services provided as you had originally thought. In some cases, people receive higher bills than expected based on the level of treatment and what care was required. No healthcare system is perfect, but in the United States, we have one of the best healthcare systems backed by some of the best healthcare providers in the world. Despite some of the horror stories we may see regarding bedside manner of a provider or exorbitant billing from some hospitals, the majority of providers do practice exceptional medicine. People don't often call the news station or post on their social media accounts that their doctor has performed great care. It's usually only when on those rare instances that something goes awry that we hear of it. And hearing those exceptions often can tend to paint an unpropitious picture of healthcare providers and the system itself, which is not fair. The majority of providers do have our best interest at heart and take the Hippocratic Oath very seriously. It takes a special kind of person to be a healthcare provider or to work in any capacity of healthcare, and they operate ethically and legally within the system that they have been provided. That being said, I'm all for us doing our own part to stay healthy through diet, exercise, and lifestyle change. That's going to do it for the season finale of Season 2 of the Living Healthy podcast. I hope you and your family had a great Christmas, and I wish all of you a wonderful New Year. As always, thank you for your continued support. Thank you for listening, and I'll see you, God's willing, next year for Season 3 of the Living Healthy podcast. And remember, living healthy creates a better you.